6:23 now, with COVID cases rising across the country, Matt Hancock has admitted we're at a coronavirus tipping point. To stop numbers shooting through the roof, the government has said effective action must be taken. And despite dire warnings about the economic impact of another total lockdown, the Health Secretary has refused to rule it out as an option. So is it time for a second national lockdown? Joining us to discuss that is Dr. Bharat Pankhania. Good morning to you. Thanks very much for joining us this morning. So we're hearing all the warnings. Matt Hancock has said it's a tipping point. Chris Whitty has talked about it being a crucial point. What's your view on what we do from here? Because there's talk of curfews, there's talk of a circuit breaker, a second national lockdown. What needs to happen?
Well, we know that the infection is transmitted from humans to humans. It is so obvious. It's really, really blindingly obvious, as I put it. Therefore, what you do is you take all measures possible to tell people to segregate themselves from other human beings. You reduce your circulation amongst fellow human beings. It's as straightforward as that. And by the way, it's pointless trying to blame people for this rise in number of cases, because whilst there are behaviors where people are getting infected, we need the government, the politicians, to get their messages right and take timely actions.
So you think the government's been getting it wrong when it comes to the messaging they've been giving people?
The messages have been ambivalent since January. I wish we had had a clear, understandable, succinct messages and not have any ambivalence. So take for example, rule of 6. You could mix with 30, 40, 50, 60 people as long as you're in a group of 6. In other words, it makes it pointless. Similarly, the bars and the clubs or restaurants closing at 10 p.m. as if the virus becomes more infectious after 10 o'clock. So all of these are really ambivalent messages, and we should have got our act together. We're a clever nation.
So when you say that all measures possible should be taken for people to distance themselves, would you go as far as saying that means effectively a second national lockdown, or would you give people the chance to comply and say, stay at home if you can for the time being and see if that squashes the numbers?
I don't think we have the stamina for a second lockdown, and we can't just carry on opening and shutting. So what we've got to do is take the people with us, and you reduce your movements. And as you say, we're going to work from home where you can. Don't circulate in places where you can get infected and infect others. Reduce congestion on transport. Don't go to the office if you can stay at home. And all those extra measures over the long term is what will get us through, not dramatic lockdowns.
How mismanaged do you think the testing has been? There's another front page story in the Mail today about care homes testing disgrace, results taking up to 15 days, swabs thrown away. Of course, we've talked before about the fact that people have had to either travel miles or not be able to get a test. What are your fears over what's happening with the testing system at the moment?
It is very disappointing. From the beginning, we have always said, why haven't you empowered the local National Health Service, university and other labs to also take part in testing? Because then it becomes an asset for the nation. To have this centralized testing and then the backlog implies we are now blinded. We are not testing enough because we haven't got the capacity. Therefore, we don't know. We don't know about the potential number of cases that are already positive. So we've made errors. It's a gamble in centralizing it. And even now, at this late 11th hour, we should say to the local NHS and university labs, increase your capacity to test, because that's the way it's going to be in the next year, next 2 years, local labs doing local testing.
OK. Dr. Bharat Pankhania, thanks very much for joining us this morning.